Good morning, my dear students and friends. Again, I am back with a very interesting topic, which is called as the blood. This is very interesting. So kindly go through the topic very well and understand what all are the important things. As you can see in the diagram, we can see the heart, kidney, arteries, veins, the suprarenal glands, and the human being which is standing in the anatomical position. Objectives of this chapter. After studying this chapter, you will be able to name the parts of the blood system and discuss the function of each part, define combining forms used in building words that relate to the blood system, identify the meaning of related abbreviations, name the common diagnosis, clinical procedures, and laboratory tests used in treating the blood system. Objectives continued. List and define the major pathological conditions of the blood system, explain the meaning of surgical terms related to the blood system, recognize the common pharmacological agents used in treating the blood system. Okay, my dear friends. So now moving on forward, this was just in short about the objectives of this chapter. Structure and function. Blood. It is a complex mixture of cells, water, proteins, and sugars. Okay, it transports the nutrients, oxygen, and hormones to all parts of the body. That is, the human body helps to regulate the body temperature, helps in maintenance of the stability of the body's fluid volume. In the fluid volume, we can see the ICF and the ECF. It transports the waste products away from the body cells. Structure and function. Without blood, human life is impossible. Composition of the blood. It is as follows: fluid portion, plasma consisting of water, proteins, salts, nutrients, vitamins, and the hormones. Cellular portion, blood cells consisting of the red blood cells, white blood cells, platelets. Okay, and serum. Note, if some proteins and blood cells were removed from the plasma, the remaining fluid will be called as the serum. This point is very much important here. Structure and function. Plasma. Clear liquid made up of 92% water and 8% organic and inorganic biochemicals. Albumin in between, in the center, you are seeing the plasma proteins, and other plasma proteins are the albumin, globulin, prothrombin, and the fibrinogen. Red blood cells, also known as erythrocytes, produced in the bone marrow in response to erythropoietin. Mature red blood cells have no nucleus and appear biconcave. Hemoglobin is a protein in RBCs that is essential to the transport of oxygen. Red blood cells live about 120 days. This is the structure of the red blood cell. Hemoglobin breaks down into hemoglobin. Red blood cell count. Average red blood cells in a cubic millimeter of blood. Males 4.6 to 6.4 million per cubic mm. In females 4.2 to 5.4 million per cubic mm. Structure and function. Leukocytes are also known as white blood cells or the WBCs. They function to destroy foreign substances. Two main groups are granulocytes and agranulocytes. In the granulocytes, we have neutrophils, eosinophils, basophils, and in agranulocytes, we have monocytes and the lymphocytes. In the structure and function, platelets, also known as thrombocytes, live for about 10 days, assist in blood clotting. So red blood cells and the platelets damaged. Okay, platelets begin to adhere to the tissue edges into each other as blood escapes. They form a soft platelet plug. Other clotting factors make a stable plug or clot. Tissue mends and antithrombin and other agents break down the clot. Blood types, structure and function. Blood types. Four human blood types or blood groups exist. Individuals needing a blood transfusion must be karyotype. Blood typing is based on the presence of antigens and antibodies. Blood types are AB, and O. People with type O blood can donate to all other blood types and are called universal donors. Individuals with type AB are called universal recipients. RH factor. In addition to the blood type, There is a positive or negative element found in the blood. Rh positive blood contains an antigen first identified in the rhesus monkeys. Rh negative blood does not contain the antigen. The Rh factor is very important during pregnancy because a mother that is Rh negative carrying Rh positive fetus will develop antibodies to fight the Rh positive blood cell with future pregnancies. This is called as erythroblastosis fetalis. First pregnancy, Rh negative mom with Rh positive fetus, antibodies develop. Second pregnancy, another Rh positive fetus. If this mother did not receive Rogam after her first delivery, this baby's blood cells will be attacked erythroblastosis fetalis, which could be fatal for the baby. Combining forms and abbreviations, agglutinin, eosinophil, erythro, red, hemato, blood, leuco, white, phago, eating, devouring, thrombo, blood clot. EPTT, activated partial thromboplastin, basophil, biochemistry panel, bone marrow transplant, complete blood count, differential blood count, eosinophils, ESR, erythrocyte sedimentation rate, granulocyte, colony stimulating factor, granulocyte, macrophage, colony stimulating factor, hematocrit, hemoglobin, mean corpuscular hemoglobin, mean corpuscular volume, monocyte, PCV, platelet count, polymorphonuclear neutrophil, prothrombin time, partial thromboplastin time, red blood cell count, sedimentation rate, segmented mature white blood cells, white blood cell count. Diagnostic procedure and laboratory terms. The withdrawal of blood for examination is known as venipuncture or phlebotomy is used very frequently as a diagnostic tool. Common blood analysis, complete blood count, common screen for basic medical checkup, blood and assays, measure size, volume and content of red blood cells, Twins test, test for antibodies on red blood cells, ESR, measures rate at which RBCs fall through plasma, hematocrit measures packed RBCs in a sample. Blood chemistry tests plasma for various substances such as glucose and electrolytes, white blood cell differential test, number and types of leukocytes, prothrombin time test for coagulation defects, hemoglobin measures level of hemoglobin in the blood, blood culture tests a blood specimen in a culture to identify the presence of microorganisms. Pathological terms, dyscrasia is a general term for any disease of the blood with abnormal material present. Anemia, general term for a condition in which red blood cells do not transport enough oxygen to the tissues. Causes may be related to a low number of cells or due to a low amount of hemoglobin. Common types of anemia, iron deficiency anemia, aplastic anemia, pernicious anemia, sickle cell anemia, hemolytic anemia, and post-hemorrhagic anemia. Disorders related to excessive bleeding, hemophilia, hereditary disorder in which there is a lack of the clotting factor 8, treated with medications and blood transfusion. Thrombocytopenia, bleeding disorder with a lack of platelets occurs in the condition called purpura, which is the presence in which there is the presence of multiple tiny hemorrhages under the skin. Disorders related to substances in the blood, common disorders, pancytopenia, low number of all blood cells, hemochromatosis, hereditary disorder that causes excessive iron to build up in the blood, erythropenia, low number of RBCs, poikilocytosis, irregularly shaped RBCs, reticulocytosis, abnormal number of immature RBCs. Common disorders continued hemolysis, breakdown in the red blood cell membrane, macrocytosis, abnormally large red blood cells, anisocytosis, red blood cells very incision shape, microcytosis, abnormally small RBCs, polycythemia, abnormal increase in the red blood cells and hemoglobin. White blood cell disorders, leukemia, neoplastic disorder in which there is an excessive increase in the WBCs, granulocytosis, and normal increase of granulocytes in the bloodstream, commonly seen during times of infection, multiple myeloma, malignant tumor of the bone marrow. Surgical terms, common procedures, bone marrow biopsy, needle is inserted into the bone marrow cavity and bone marrow is removed for analysis. Bone marrow transplant performed for serious conditions such as leukemia. Donor bone marrow is inserted into the patient's bone marrow. Pharmacological terms: anticoagulants prevent the blood from clotting. Common anticoagulants: generic name warfarin, trade name Coumadin, heparin, calciparin, aspirin, Bayer. Coagulants aid in clotting of blood. Common coagulants: generic name, trade name phytonadione, methadone, vitamin K, quinacaone. Hemostatic stops blood flow within the vessels. Common hemostatic generic name desmopressin, trade name concentrate, amino caproic acid, amicar. Thrombolytics dissolve the blood clots. Common thrombolytics generic name, trade name LT-Plays. They are LT-Plays, Activase, Anis triplase, aminase, streptokinase, streptase, urokinase, and abokinase. Okay, so these are some of the general knowledge questions. Jimmy is in an auto accident. His medical alert bracelet reads hemophilic. Which of the following conditions would be most serious for Jimmy? Infection, bleeding, fracture. Answer is bleeding. Sarah is in desperate need of a blood transfusion after type and cross match of the following individuals. This would be most likely the best donor for Sarah, whose blood type is A plus: John, Carol, Steve. Answer is C, Steve. Mr. Harrell has had a heart attack and his physician instructs him to take an over-the-counter medication that will keep his blood thin. The following medications would be appropriate: Malanta, Bayer, don't spill, Bayer. So, my dear friends, this was a brief introduction about the blood. Okay, I hope you have understood. So,